So soft tissue treatment and the palpation. Okay, so we're going to practice this. How you palpate supraspinatus. Find superior angle. Okay, find the spinal scapula. It's big and fat and wide towards the superior angle, and it kind of tapers down. Get in there. Always palpating perpendicular to the muscle fiber direction. It's going to give you a lot more info. Go this way, I don't know, can't find it. But you go this way along, like you're strumming a guitar, you will find big taut bands. And almost everybody is going to have, maybe not the super mobile people, but infra and teres, same deal. So here's the spine of my scapula. So you can kind of envision the muscle fibers running this way, and then Ivy's got her fingers palpating like that. Subscap. That's not a comfortable one to palpate. Subscapularis testing is the rectal exam of the physical therapist. It's a little wet, it's smelly, and it's dark. But if you don't do it, you're going to miss a lot of problems. Okay? Because these guys present with shoulder pain that makes sense in a lot of other ways. And you get down there and they go, oh, my pain that's it. And you just hold it, and you can do your ischemic soft tissue, you can do whatever, strumming. We use needling a lot, and this thing jumps all over the place. And for those of you who don't know, that's kind of what you're trying to get. When you put a needle into a taut band, you get a spinal reflex contraction, it loosens that taut band, and you do it repeatedly until it stops. And it's very effective, it works fast. But this is where you're going to get it, and typical wristwatch pain, which is funny, because I have carpal tunnel syndrome. My doctor says I have carpal tunnel. He says my shoulder might be screwed up too. They're thinking about doing a release, or cutting out a clavicle, or cutting out my first rib. Oh my God. And they don't touch you, obviously. They just ask you where it hurts. We have to advocate and educate these people. What are we looking for? Simple. I mean, I always, you comfortable? You bend your knees a little more. All right, great. So what am I looking for? Medial border. Okay, superior angle. If I can't find inferior angle, I'm going to slide her back a little bit. There it is. Okay, and so now I know where I'm at. Okay, your hand comfortably like this? Mm-hmm. Great. Superior angle, supraspinatus. Okay, and through here, feeling for taut bands, any like, ow, that hurts my head or whatever. You are going through traps here, so note too, you may have like, oh, my jaw hurts or my back of my eye, and so you can do thumbs or whatever. I'm trying to just show you guys. I would be over here definitely. Infra and teres, again, inferior angle, find the lateral border, there she is, and then these muscles run this way. And as you come toward the spine of the scapula, they move this way, so you have to change what you're doing. So, yuck, right here, you can see it, so you can feel it. Yeah. And I'm just kind of palpating. The majority of the trigger points here below the spine of the scapula are going to be more on the lateral border. Wow, that's gross. Good. And if I held it in one spot, what do you feel? Probably doesn't feel good. Okay, and this is the treatment for it. Ischemic pressure. I can do a lot of strumming. Yeah, none of that feels good. So those are simple. On your back. Subscap. I'll try and keep you room. Have the patient hold their elbow in front of their chin. Hold your elbow in front. Good. And don't pull. So everybody wants to do like scarf thing. Let your arm relax. Okay. A little wider. Good. So just giving me room. Now I'm going to find the medial border and pull that arm to me. So now here's her chest wall, and straight down it's going to be subscapularis. So inferior angle, and I'm going to find a ton of crud in here. Right here is just awful. And I didn't have to even search. Just breathe.
It's hard.
You have to check this. If there's a lot of deodorant or whatever I use, when I needle this, I kind of clean it up a little bit. That stuff doesn't get in the way, and usually people, patients are just like, oh my God. But when you make the pain in the back of their arm light up, they believe what you're talking about right away.